In putting his signature on what came to be known as Obamacare, the president did what others had tried to do and failed many times since World War II, starting with Harry Truman.
He wanted to increase the availability of doctors, of hospitals, and have the government serve as a guarantor of insurance for all Americans.
But in Congress, Truman's plan never got so much as a vote.
We do not want socialized medicine.
In the 1960s, Ronald Reagan, before becoming governor of California, recorded this message: pass Medicare, and the United States would soon become like the communist Soviet Union.
One of these days, you and I are going to spend our sunset years telling our children and our children's children what it once was like in America when men were free.
But Reagan's efforts fell short, and in 1965, President Lyndon Johnson signed the law creating Medicare and Medicaid for the poor. And it wasn't just Democrats. Richard Nixon had big ambitions on health care.
Richard Nixon, which I happen to work for, put forth a very comprehensive plan which looks a lot in structure like the Obama plan.
Thank you, Mr.
By the early 1990s, there was the Clinton plan to cover every American without spending more.
Health care reform must be achieved for the good of our country.
Too big, opponents said, too expensive, too complicated.
We're going to lose our doctors. We're not going to be able to make medical choices anymore. It wasn't true, but these kinds of arguments resonated.
Around that time, many Republicans, like House Speaker Newt Gingrich, started talking up something called a mandate, a requirement that every American buy his or her own health coverage.
And still preserve the private insurance system. So the idea of a mandate was a Republican idea.
By 2008, Hillary Clinton, now running for president, was pushing the mandate herself.
I cannot stress to you how passionately I feel about fighting for universal health care.
Back then, though, candidate Obama was against it.
Senator Clinton says, I'm going to make universal health care by mandating that everybody buy it. But if people can't afford it, it doesn't matter what the mandate is, they're not going to buy it.
But by election time, he had come around to Clinton's position. And now, Obamacare will likely rise or fall on that very pillar. Dr. Sanjay Gupta, CNN, reporting.